Mic checking. Mic checking. Mic checking. Okay, guys. You're welcome. Let me address this right here. Okay. Good evening. Good afternoon. Good morning. Wherever you're watching us from. My name is Ness Evie. As always, we are live from the farm this Sunday also. Okay. So today we want to continue our discussion on medical terminologies. I think 2 weeks ago, I beg your pardon, we spoke about some medical terminologies and what they mean. Most of the conversation we do at the hospital and what you hear, what you see. And then for medical students, nursing students, health professionals as a whole, this will just be like a reminder or a refresher for you. So, without much ado, let's dig right in. So, we want to look at some general ones. Where can we put this on? Yeah, right here. Okay. All right. So, let's start off with some general ones. Okay. Some general ones. So, anytime you hear something like hyper, I think we spoke about that last time. Hello, you're welcome. Thank you very much for joining. This is Smart Nursing. And if you can hear me, can you give me a like or do something? Give me a hi, a hello, or okay. All right. So we want to continue, all right, with some prefixes. The last time we spoke about hyper, what hyper means, we spoke about hypo. Okay, we want to continue with some prefixes. Thank you. Hello, you're welcome. My name is Ness Evie. This is Smart Nursing, and we do this on Sundays. We come live from the farm. And so I would like to know your name and where you're watching us from. Your time there actually, because it's at almost 4 p.m. here in Ghana. We are live from Ghana. So you can give us a hi if you can hear me, and then give this video a like, okay? Thank you very much for joining. You can give us a hi if you can hear me. Give me a wave. Let us know where you're watching us from. We are live from Ghana. Let me know if you can hear me. Kindly give me, send a hi, give us a like, do something for us to know you can hear us. Okay. Thank you very much. So today we are talking about medical. We are continuing our video on medical terminologies. We started 2 weeks ago and then we spoke about some. So in continuation, anytime you hear you, okay, so it's EU, it's spelled EU, but we say you. Okay, anytime you hear you, it means normal, or ew, it means normal. You can hear something like euvolemic or euvolemic. It means normal blood pressure or normal volume. Any prefix that starts with E and U, it means normal. Okay. Another example is eupnea or eupnea, depending on the part of the continent or part of the globe you're from. You can pronounce it anyhow you want. Okay. But anytime you see a spelling with an E and a U, then it means that whatever will come after that means normal. It is normal, it is good, it is of standard. It's what we expect to to see. Okay. All right. So let's continue with some common suffixes. Okay, we've done some prefixes like hyper, we've done hypo. Okay, we have tacky, we have brady, we've done all those things. Tacky means very fast, brady means very low. So whatever is following the tacky or brady, then it means it's either high or low. For example, if it's tachycardia, it means that your heart rate is high. Okay, if it's bradycardia, it means your heart rate is low. Okay, if it's tachypnea, it means your breathing is high, and if it's bradypnea, it means your breathing rate or respiratory rate is low. So now let's do some suffixes, things that come after a word or something is mentioned. The first one here today is itis. Itis or itis, depending on where you are. Again, itis or itis is spelled I-T-I-S. I-T-I-S. Okay. An example is arthritis. An example is arthritis. Okay. Arthritis. It means inflammation of the joint. So anytime you hear the suffix itis, anything that ends with itis, it means there's inflammation of that part of the body. For example, if you hear gastritis, gastritis, it means inflammation of the lining of the stomach. Okay. Esophagitis, itis, inflammation of the lining of the esophagus. Okay. Anytime there's an itis, after a word, it means inflammation of that word or inflammation of that part of the body. If it's your skin, you can hear something like dermatitis, itis. It means inflammation of the skin. Okay, so anytime you come across itis, it means inflammation. All right. Okay. Next on our list, we have ology. Okay, ology, like Ology. It's a suffix. So something will come, then ology will follow. All right. So for example, sociology. Sociology. Okay, means the study. So ology means the study of. Ology. It means the study of. Okay. So sociology, study of social sciences. All right. You can have biology. It means the study of biological, phenomenon. Okay. Pharmacology, the study of pharmacy or pharmaceutical services. All right. So anything ology, it means the study of. Okay. Another example can be cardiology. Cardiology is the study of the heart and its functions. All right. So ology means ology. If you're joining us for the first time, if you're now joining us, welcome on board. This is Smart Nursing live from the farm. Those who have been following us for a while now knows that on Sundays we do this from the farm after church, because we farm also and we visit the farm on Sundays, and so we are live from the farm most of the times on Sundays. Okay, either we are discussing nursing, or we are saying something about nursing, or we are discussing something about farming, or showing something new that we are doing on our farm. All right, so this is Smart Nursing, and then once again, you're welcome. I will be very, very glad to know where you're watching us from. I would like to know your name, where you're watching us from, and what time is it in your country. Like I said, it's almost 4 p.m. It's 3:53 actually here in Ghana, p.m. in Ghana. So I would like to know. And kindly give this video a like. Okay, we are discussing some medical terminologies today. So now let's look at algia. Algia. It's a suffix, okay? Algia. 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 What does algia mean? Anytime we say algia, it means pain. Algia, pain. Algia, algia, it means pain. So, for example, we can have myalgia, Malalgia, myalgia. It means pain in your muscles. All right, pain in your muscles or generalized bodily pains. Okay. Another example is neuralgia. Neuralgia. It means that there's some pain in your neck or there is a pain associated with your nervous system. Okay, so anytime you hear algia, it means pain. Okay, how about oma? Oma or oma? Okay, OMA. OMA. What does it mean? It means a tumor or a mass. It means a tumor or a mass. Now, tumors and masses actually, their specific names are coined or generated from the part of the body that they are affecting. Okay, but you will see a common surface for all of them. You will see that OMA at the end of every, you know, tumor that is being described. So anytime you see an OMA, it means a tumor. But the main part of the body that is being affected will determine how that name will go. Okay, so anything like carcinoma, you mean or you understand that there's an OMA at the end, and so it's a tumor. Or you hear something like a sarcoma, it tells you that, hi, Tafik, hi, hello, thank you, my Ghanaian brother, as I can see. Thank you for joining. All right. So anytime you hear OMA, then it means that that is a mass or that is, a tumor. All right. Let's continue with some root words like cardio. I mentioned something earlier. I said cardiology means the study of the heart. Okay. So anytime you hear anything cardio, it refers to the heart. Cardio means the heart. Okay. Cardiology, cardiac, um, cardiac enzymes, cardiac whatever, cardiac this, cardiac that. Okay. All those things refers to what? The heart. Okay. And so a cardiologist will be a specialist of the heart. It's a doctor who has specialized in managing issues or conditions of the heart. Okay. That is a cardiologist. All right. So cardio means heart. Now, gastro also stands for stomach. When we're talking about inflammation, when I said itis, anytime you hear an itis, it means inflammation. I gave an example of gastritis. So gastro is or stands for the stomach. So gastritis will mean what? An inflammation of the stomach or an inflammation of the linings of the stomach. Okay. Now, let's continue and look at neuro. We spoke about neuralgia earlier, remember? When I said algia stands for pain, and I said neuralgia means a pain of a nerve origin. All right. So, neuro means nerve. Okay. Neuro, it means nerve. A neurosurgeon is a surgeon who is specialized in the nervous system, managing the nervous system. And don't forget, the nervous system has two main parts. We have the central nervous system and we have the peripheral nervous system. The central nervous system, which consists of the brain and the spinal cord. Okay, so a neurologist will be somebody who will work on the brain, somebody who will work on the spinal cord. Okay, that is a neurologist. So neuro stands for what? Nerve. Okay, Let's continue looking at some more root names, and then we look at hemato. Hema. Hema. Hi, Jerry. Hello. Thank you for coming. And this is Madness, saying you're welcome. We are discussing medical terminologies. We're actually continuing from a video we did last 2 weeks, and we usually do this on Sundays. We are live most of the times on Sundays from our farm. Okay, but on this channel, we discuss nursing and its related issue. Thank you for the like, guy. I am very grateful. I see Tofik is from Ghana, but I would really want to know where Jerry is watching us from so we can give you that special shout out. And I would like to know the time, okay, at your place. I keep asking. Yes, I'm grateful. I'm grateful, Jerry. Thanks for joining. Where are you watching us from? Let us know. All right. So, Hema means blood. Hema or Hemato. Oh, you're from Ghana as well. That's good. Thank you, my Ghanaian people. Thank you all for joining. Oh, that's great. Which part of Ghana are you from? I am live from the Volta region, Pando to be precise. Which part of Ghana? Um, a Greater Accra. Okay, that's good. I'm in the Volta region. Okay, thank you so much for joining. All right. So I was saying that anytime you hear Hema stands for blood. Okay. So hematology will mean the study of the blood. Remember, we said anything ology means a study of. So hematology means study of the blood. Okay. A hema cell is a type of a blood product that we infuse. Okay. So hema means blood. How about derma? So it's either derma or demo, but it's a DEM. I also gave an example earlier that dermatitis means what? Inflammation of the skin. So derma, anytime you hear derma, you're talking about the skin. DERM. It means the skin. So dermatitis, inflammation of the skin. Dermatology, the study of the skin. Anything derma is skin. Okay, we have some dermatological ointment, topical ointment that we apply on our skin for rashes, for wounds and all that. Derma means skin. Okay. All right, let's continue. How about osteo? Osteo. I'm sure you might have heard of osteoporosis, osteomyelitis, osteoarthritis. Okay. Osteo stands for the bone. Osteo. It stands for the bone. Okay. So anytime you hear osteo anywhere, we are talking about what? The bone. Thank you guys. Thank you so much. You're doing so well. Very fun. Now let's talk about some diagnostic procedural terms. Diagnostic procedures are the investigations we do in order to help us diagnose a patient. In addition to your signs and symptoms and our assessment, we also do diagnostic investigations like the labs, like some scans, to be able to contribute to diagnosing a patient. Okay. So when we hear or you hear us say biopsy, biopsy, biopsy. Biopsy means removal of a tissue for an examination. So maybe there is a tumor somewhere, there is a growth somewhere that we see and we are curious about. We take a little piece of that tissue, send it to the lab, and then someone called a pathologist will study that tissue and then be able to tell us what is causing the growth or what organisms are present on that tissue. So when we take a piece of your tissue, be it your lung tissue, your heart tissue, your prostate tissue, breast tissue, whatever tissue it is, when we take a little piece of it, we call it a biopsy. Okay, a biopsy. So a biopsy simply means taking a little piece of your tissue for examination. Okay, all right. Then we have CT scan. What does CT scan stand for? Anybody knows what CT scan means? Can anyone tell me what CT scan stands for? Have you heard CT scan before? First of all, have you heard CT scan before? If Jerry, Tofik, anybody still here? Have you heard of CT scan? If yes, what do you think CT scan means? Or what do you think it stands for? Thank you so much, guys. Medamu nasi. I'm speaking to Yakpenami. Yeah. Anybody? Jerry? Is Jerry still here or who is here? Have you heard of CT scan before? Do you have an idea what it means? Oh, I should go ahead. Okay. I think that's my cue. So CT scan or CT means computerized tomography. Okay, computerized tomography. So CT scan is computerized tomographic scan. Okay, and it's an imaging testing that we use, to do a detailed cross-sectional examination of the body. Okay, it is higher than an X-ray. X-ray also takes a picture of part of the body and then we study it. But then the CT scan gives us higher resolution. The quality is more, appreciated when it's a CT scan. The CT scan is able to penetrate more tissues than the X-ray. All right, so that is a CT scan. Then we have an MRI, which is now ahead of the CT scan. So there's an X-ray, there's a CT scan, then there is MRI. And MRI simply stands for magnetic resonance imaging. Magnetic resonance imaging. It also uses high resolution to penetrate, body fields and gives us a vivid idea of what is going on. For example, if you're suspecting a disease condition in the heart, you can do a CT of the chest, okay, to see. Maybe you're suspecting something in your lungs. You can do an MRI of it. You can do it of any part of the body. You can do it of the brain, of any organ at all that you are suspicious of, and it will give you a vivid idea of what is going on there. All right, how about ultrasound? How about ultrasound? For ultrasound, we use sound waves, okay, to pick up specific maybe pathologies or specific disease processes ongoing in somewhere of the body. For the difference between CT, X-ray, MRI is that they use rays, okay, but for ultrasound, we use sound waves. Okay, that is when you go and they will pick something like a probe, you put it on your, if it's your abdomen, they put it on your abdomen, wherever it is, to look for, movement. They will pick sound waves and then paint the image onto or print the image onto a monitor. You can print it on a paper, then you give you an idea of what is going on in the body. Okay, so that is one of the diagnostic terms we use. Then we have an endoscopy. Endoscopy. I'm sure you might have heard of endoscopy before. Okay. Anytime we do an endoscopy, it is a procedure that we use to look inside your body, using a flexible camera, very, very flexible camera that we can insert into your mouth if we want to look at your, you know, digestive system from head to toe. It is called an endoscopy. But we also have specialized ones we use. If we are passing it through your anus, we call it colonoscopy. Okay, so anytime we insert a flexible camera into any viscous or hole in your body to see what is going on there, we call it endoscopy. It is one of the diagnostic, very key diagnostic investigative, you know, um, investigations we carry out when we want to diagnose peptic ulcer disease. Okay, visualizing the linings of the stomach wall will best tell whether a patient has a PUD or pelvic peptic ulcer disease or not. Okay, yeah. If you have been joining us or listening so far, thank you for joining. Thank you for listening. Thank you for watching. This is Smart Nursing as always, and today we are discussing terminology, some medical terminologies. We're actually continuing from the last time, discussing medical terminologies that we use in nursing, in healthcare. All right, and we are live from our farm today. It's Sunday, and we usually are live from the farm. So let's continue and look at some common abbreviations we use. BP, we usually say BP. You know, because of the nature of the work, how tedious the work can be, how busy it can be, and the pressure, maybe the number of patients, the number of procedures, whatever you need to do. So we have a lot of abbreviations. We can't pronounce everything fully. Okay. So we are just going over some of the abbreviations and some of the terminologies. So one of such, one very common is BP. One very common abbreviation is BP. And we all know what BP means, don't we? Can anybody tell me what BP is? Who has joined us so far? Who is just joining us? We are discussing some medical terminologies we use in nursing. We're also going over some abbreviations that we commonly use in nursing. And I just said one of such, one of the very common ones is BP. Do you have an idea what BP stands for and would like to share with us? Hello guys, who is here? Anybody here? I would like to know where you're watching us from though. I always say that I'm so glad and grateful to all my followers and my companion this evening. And so I would like to know where you're watching us from. I would like to know your name so I can address you by your name personally. Okay. So who knows what BP stands for? I know you know. So BP simply means blood pressure. Okay, so instead of going through all the hassle of bustle of saying blood pressure, why don't you just say BP and go ahead? And it's so common that everybody knows it. So BP simply means blood pressure. HR stands for heart rate. HR, no human resource. HR stands for heart rate. Okay. Then RR stands for respiratory rate. RR stands for respiratory rate. Sometimes you will hear us say temp, TEMP. That is simply temperature. Okay. Then MPO means nil per os, where nil per os means nothing by mouth. We usually put people that we are preparing for surgeries or people who have just been out of a surgery. Okay, we put them on what we call nil per os protocol or nothing by mouth until your bowel sounds return. That is, if you have gone for a surgery, you will be on nil per os. You will not take anything by mouth until your vowel sounds returns. All right. If you're going for surgery, we will put you on NILPE or some hours to about 6 to 8 hours to your surgery in order to clear your bowels so there won't be anything like aspiration from vomiting during the procedure. Okay. So NILPE all simply means nothing by mouth or MPO. Simply put, NPO. You label it boldly on the patient's bedside that everybody will know and not give the person or the patient anything mistakenly through the mouth. All right, PRN. PRN. You will see this PRN mostly on medication, sorry, on medication prescriptions. Maybe you will see tab paracetamol, 1 gram PRN, injection diclofenac 75 milligram PRN. PRN means when necessary or as and when it is needed. Okay, so anytime you see PRN like that, it means as and when it is needed, do this particular procedure or give this medication or do this or do that. Okay, thank you guys for joining. If you're new, give us a hi, give us a like, and let's see where you're watching us from. Hi. Okay. Um, So Hot is from Ghana and he's an Asante. Wow. Beautiful. He or she is an Ashanti. I'm an Ewe and I'm from the Volta region. I'm live from Volta. Thank you so much for joining, guys. Thank you so very, very much. So we are discussing some medical terminologies or some abbreviations we use in nursing. And right, let's continue. Okay. We have here some vital signs assessment terms. So your vital signs are the languages that we speak with your body when you come to the hospital, the language that we understand together with your body, what your body tells us is wrong with you. Okay, that is what we refer to as vital signs. So, oh no, our light. I just hope you can see me, guys. Almost, it's 4 p.m. here. Hi, Stephanie. Hello, Stephanie. You're welcome. Stephanie from Paul. I'm guessing you're Ghanaian too. Today, my people are showing me love. Thank you so much for showing me love today, my people. Because I'm guessing you're from Ghana also. From home. Hello, Cheese. Hi, Cheese. Thank you so much, Cheese. I'm very grateful. I am very, very grateful. Thank you for your kind words. Where are you watching us from, Cheese? Let us know where you're watching us from. Okay. And give us a like. Thank you so much. So, what does apnea mean? What does apnea mean? Apnea. APNOEA. When we check your vital, specifically your respiratory rate, and then we say you are apneic, what does it mean? Apnea means cessation of breath. Okay. It means there is absence of breathing. It means that we can't see anything that signifies that you are breathing. When people hold their breath, you can say the person is apneic at that point. So apnea means no breathing activity. Okay. All right. Now, dyspnea means difficulty breathing. Someone comes and says, I can't breathe, I can't breathe. That is described as dyspnea. Then cyanosis. Cyanosis. What is cyanosis? Cyanosis means there is a bluish discoloration due to lack of what? Oxygen. So if we say somebody is cyanosed, or we say somebody's body is cyanosed or skin is cyanosed, it means that there is absence of oxygen to that part of the body and it has made that place blue. Okay. Sometimes some babies are born and they are cyanosed. It means there is no enough oxygen in their body. The skin, instead of being pink, will be blue. Okay, so that is for cyanosis. Then edema means swelling of something due to fluid buildup. Okay, so when somebody comes and then the leg is swollen, you can see that the leg is swollen significantly. You can press it and you feel some indentations inside. That is what we call edema, sorry. And it's as a result of fluid building up inside the tissues. It's not supposed to be there. So that is edema. Okay. All right. How about febrile? We say someone is febrile. If we say you are febrile, it means that you have a fever. Febrile, a febrile condition, a febrile patient. You can hear people say malaria is a febrile condition. Okay. Ebola is a febrile condition. Okay, it means that when you have those conditions, your temperature goes high and you have a fever. So anytime you have a fever, your body feels warm, your temperature is more than normal, we say you are febrile. Okay, all right. Thank you, thank you. Let's continue and talk about some anatomy. Okay, anatomy. Anytime you hear anatomy, nursing students run away. Everybody is scared of anatomy. Anatomy is like calculus of it all. Okay, so let's do some anatomy and some body system terms. Okay, cerebral. Cerebral. What is cerebral? Cerebral stands for the brain. Cerebral stands for the brain. Okay, so for example, cerebrovascular accident. Cerebrovascular accident. It means there's an accident in your brain, as simple as that, and that leads to stroke. Okay, CVA for short. It means that there's a problem in your brain that has led to what? A stroke. Okay, then Mayo. Mayo. But before we get to Mayo, cerebral is brain. Okay, cerebral vascular accident means an accident in your brain. But there are two words in that. There are two parts in that word. There's cerebral or cerebral, and there is vascular. Okay, so cerebral is for the brain, and vascular is for the blood vessels. So the brain and then the blood vessels together have a problem that we describe as an accident that has led to a stroke. Okay, so when we talk about cerebrovascular accident, we are saying that cerebral there is standing for the brain, the vascular is standing for the vessels or the blood circulation system of the brain. Now those two together have a problem, and that problem has led to the accident or the stroke. All right, don't worry, we'll talk about CVA into details in another video. So, myo means muscle. Myo means muscle. Remember, we said algia stands for pain. I think it's drizzling, if I'm not mistaken. We said algia stands for pain, if you remember. And then I give an example of myalgia, saying pain in your muscles. So, myo stands for muscle. Okay, and then if we have a myopathy, A myopathy, it means that there is a disease ongoing in your muscles. Hepato, hepato, or HEPA, HEPA. It stands for your liver. Okay, hepato stands for the liver. Okay, let me do this. Maybe you can see my face well. So hepato stands for the liver. All right. So hepatitis. Hepatitis. If you've been following us, you know that itis stands for inflammation. So hepatitis means for inflammation of the liver. Okay. Gastritis, inflammation of the stomach. So hepato means liver. All right. How about nephro? Nephro. 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 Nephro means your kidneys or inflammation of your kidneys. Nephro, nephro means kidney. So nephritis will mean inflammation of your kidneys. How about spleno? Spleno. Spleno is standing for your spleen. Spleno is standing for your spleen. Okay? All right. So if you hear something like a splenomegaly, megaly there means mega is big. It has grown big. It has enlarged. So splenomegaly means enlargement of your spleen. Okay? All right. Let's continue with chondro. 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 Chondro means a cartilage. Chondro means a cartilage. You know we have bones and we have cartilages, don't you? So chondro means a cartilage. And so chondritis, sometimes you hear say something like costochondritis. Chondritis means inflammation of the cartilages. I am smiling because it's drizzling here and I wish it would rain because we are on the farm like you can see or you already know. And aside nursing, we do farming also, and we have not seen rain in a very, very long time. All right. And so we will be glad if it rains today. Okay. All right. So if you haven't told us where you're watching us from yet, can you let us know where you're watching us from, your name, where you're watching us from, and what time is it in your place? So let's continue and look at some disease condition terms. Okay. Let's look at some disease condition terms. All right. So we are moving on and we are looking at some disease condition terms. So if we say casino, it means cancer. If we say casino, it means cancer. Okay, so a carcinogen is an agent that can cause, that can, emphasis on can. Anytime we call something a carcinogen, it means it's an agent that can cause cancer because, mind you, nobody knows what exactly causes it, but we just have some things that we suspect, some things that are like risk factors. Okay, so a carcinogen is any agent that can cause cancer. All right, and then patho. What does patho means? I mentioned something earlier when we were talking about biopsy, when I said that a biopsy means taking of a little tissue, a piece of your tissue, and then studying it. And I said that someone called a pathologist studies the tissue to find out what the disease condition or whatever is causing the disease is in the tissue. So now we want to define what patho means. Patho. What does it mean? It means that it is the study of a disease. The study of a disease. So pathology is the study of a disease. A pathologist is somebody who studies the pattern of a disease. Okay, then a pathophysiology is trying to understand the causating, sequence or the cascade of events that has led to some signs and symptoms we are seeing. So basically, patho means study of a disease. All right. How about sepsis? Sepsis means severe infection causing organ dysfunction. Sepsis is a severe infection that has caused an organ dysfunction. So maybe the person has a hepatitis, which is an inflammation of the liver. It has led to sepsis. It has become so severe that the liver is not functioning anymore. So the person is jaundiced and there are so many liver enzymes running around his body. Okay, so sepsis stands for severe, very severe infection that has caused organ dysfunction. Okay, so let's talk about necrosis. Let's talk about necrosis. Necrosis means tissue death. Okay, necrosis means death of a tissue or tissue death. And usually, necrosis comes from ischemia, and ischemia comes from inadequate blood supply to a particular part of the body. So, for some reason, there is a reduced blood supply, like we spoke about atherosclerosis. Watch out for that video where we spoke about atherosclerosis and how it happens, and then try to understand and appreciate it better. So, if you have an atherosclerosis plug inside your blood vessel, it will reduce the blood supply to the part of that body. First, it will start with ischemia, and then if the narrowing is too much or there is a complete blockade, then you can have necrosis or death of that tissue because all the nutrients that the tissue needs to go or tissue needs to thrive is in the blood. So if there is no blood supply to the part of the body, then that part of the body will die. That is what we call necrosis. So once again, this is Smart Nursing, and we've been discussing some medical terminologies. Okay, we started 2 weeks ago. We just want to give you an idea of some of the terms we use, some of the abbreviations we use, and what they stand for. Okay, so we are going on, aren't we? Ischemia, I said already, is lack of blood supply to a tissue or an organ, and that can lead to tissue death or necrosis. Then lesion. A lesion is an abnormal tissue damage. A lesion, when we see or we say lesion, Lesion, it means abnormal tissue damage. Let's talk about comorbidity. Comorbidity means the presence of two or more diseases in a patient. Comorbidity means the presence of two or more. So the person has hypertension and has diabetes as well. The person has asthma and has hypertension. So the hypertension and the asthma or the hypertension and the diabetes will become comorbidities. They are co-parenting. They are coming together and giving pressure to this patient. Okay, so comorbidities is somebody having the presence of or the presence of two or more disease conditions. All right, how are we doing so far? Let us know if we are doing okay, if you're liking our video and you are engaging with us. It's getting pretty dark here. It's getting pretty dark, and our light is unfortunately not working today. Okay, but I hope you can see me. Mm? So let's do some diagnostic lab terms. When we take a blood sample and we take it to the lab, or you take a blood sample of a patient and you take it to the lab, what do some of the terms mean? CBC. CBC. What does CBC means? Complete blood count. CBC is a complete blood count. And then it actually measures your blood cell levels and its components. Okay, you know that blood is composed of so many cells. There are white blood cells, there are red blood cells, and there is plasma, and there are platelets, and even the red blood cells have different forms. Okay, we have the reticulocytes, which are not so matured. Okay, and then the white blood cells, we have so many of them. We have the eosinophils, we have the neutrophils, you see. So when you do a complete blood count, you are studying the cell components of the blood, and it will give you detailed description and measurement of your blood. So CBC stands for complete blood count. All right. How about CMP? CMP means your comprehensive metabolic panel. Comprehensive metabolic panel, and it's a blood test for organ function. Okay, when you do a CMP, you are studying your complete metabolic panel, and then it gives you how well your organs are functioning. You're going to have some electrolytes in there. You're going to have some important key elements of your CMP. Okay. All right. How about UA? UA means urine analysis. Some people, depending on which lab you're going to, some say urinary. Okay. Which means routine examination. RE means routine examination. Some just say UA, which means urine analysis. Okay, guys, we have been talking about medical terms, we have been talking about medical abbreviations. We've been trying to bring it to your doorstep so you understand when we mention them or when you meet them anywhere. Okay, we have started like 2 weeks ago, and then we are continuing. Today we have spoken about some prefixes, some suffixes. We spoke about some diagnostic investigations like scans, like ultrasounds. We are talking about some lab investigations. We spoke about some disease terms, some vital signs terms that we also use. And now we want to look at some treatment or procedural terms. Okay, some procedures we undertake are for treatment. Some are also for diagnostic purposes. So let's look at some of these terms, okay, and what they stand for. So what is a laparoscopy? Laparoscopy. It is a minimally invasive abdominal surgery. Laparoscopy. So remember we said endoscopy means inserting a flexible camera into a hole or into into a hole in your body. Okay, we insert a flexible camera into a hole in your body. That is called endoscopy. That is the general term. And I said that depending on the part of the body, the name can change. Like when you're using the anus or you're going through the anus, it becomes a colonoscopy. Okay. Now, when you are going straight into the abdominal cavity via a very tiny hole, very minimal invasive procedure, we use a flexible camera through a very tiny hole into your abdomen. It is called laparoscopy, and it's actually a type of surgery, very minimal. Okay. everything is seen on a large screen. Because it's a camera, the tissues, the organs of the abdomen are all magnified on a very big screen, and they use that as a guide to do the surgery. You come out and no one knows you've even done a surgery. The scar is almost gone, nothing shows. Okay, so that is a laparoscopy. Then thoracentesis. Thoracentesis, we drain fluid from the chest. Draining fluid from the chest. Thoracentesis, very minimal, very small syringe draining fluid from the chest. Then what is tracheostomy? Tracheostomy. Okay, the trachea somewhere here. So what is tracheostomy? Creating an opening in the trachea for breathing. In emergencies, we have an emergency one we do where someone is choked or someone has damaged airway. The upper part of the airway is damaged, maybe in an RTA, in a trauma, in an assault. The person cannot breathe. You can create an emergency opening in the trachea, and that should be done by a trained personnel, a well-trained personnel, somebody specialized in doing that, that can identify the trachea, because there are so many organs over there, and even it has to be a particular part of the trachea. Okay, but when you create that airway, we call it a tracheostomy. All right, and you can even do it um for a permanent, for a very long term. Okay, you can do it for a long time. Maybe there's some tumor of the upper airway, you put tracheostomy tubes there for a long time. Catheterization is insertion of a tube for draining of or for monitoring. Okay, catheterization is insertion of a tube. So if you insert a tube, any kind of tube at all, for draining or for monitoring, it is called catheterization. So you can catheterize the urinary system by putting a catheter in the urethra. Okay, you can catheterize the blood vessels or the circulation system by putting a catheter into the veins. Okay, you can catheterize the abdomen or a wound by putting a drain or a tube into the wound to drain the excess fluid over there. That is what we call catheterization. So anytime you insert a catheter for draining or monitoring purposes or a tube, it's called catheterization. Okay, guys, we are still live here on Smartness and discussing medical terms. And this point, I hope you can see me. Let me use my. I hope you can see me. I hope you can see me because it's getting pretty dark over here, and our lights unfortunately has decided not to work. So I'm using the tablet to show my face. And then I hope you can see me. But it's a smart nursing, and we are discussing medical terminologies. Okay, all right. Let's continue by looking at dialysis. What does dialysis means? It is a process of filtering the blood when your kidney fails. So I know you've heard of dialysis, especially when it comes to the cost, because it's very expensive. And where I come from in Ghana, we don't have so many centers doing dialysis. And so every now and then you will hear dialysis for one reason or the other in the news. It's either somebody is sponsoring it or there is no money or something. But I know you've been hearing about dialysis, but what exactly does dialysis means? When we say dialysis, it means that we are filtering the person's blood because his kidney has failed. It is the job of the kidney to filter poisonous substances or toxic substances in our blood that are toxic to us. The kidney is responsible for filtering them out of the blood, and then we pass it through our urine. But if for some reason the kidney has failed, the kidney is not functioning as it's supposed to function, then we can use an artificial kidney, that is a machine that works as a kidney to filter your blood. Okay, so you are connected via some specialized created outlet, and then you are connected to the body is connected to the machine. Your blood goes through the machine, and then the machine will filter the poison, and then it comes back to the patient. That is what dialysis stands for. Intubation. What does intubation stand for? When we say intubation, what are we saying? Intubation means inserting a tube into your airway to assist breathing. So if somebody cannot breathe, first, depending on the severity, you will start by administration oxygen, maybe via some tubes in the nose, via some marks on the face. That is not working. You can insert, some airways. Okay, all those things are not working. Then you have to insert a tube all the way to the trachea of the patient. That is what we call intubation. You are putting a tube in situ, or you are putting a tube in position of the patient. Okay, that is what you actually do when you're connecting a person to the ventilator, where some people call the life machine, or what is it called? I think it's called life. I think it's called life machine or something like that. Yes. So you connect the person to a ventilator via what is it called? Intubation. All right. So we've been talking about some medical terminologies today. This is smart nursing. And then on Sundays, we come to the farm. Okay, we are live from Ghana, somewhere in the Volta region, Pandu to be precise, on our farm. We are discussing medical terminologies and some medical terms that we use. And so if you're joining us for the first time, or you're now joining us, thank you so much for coming. All right, let's continue by looking at some pharmacological terms. Some pharmacological terms. Let me hold it this way so you can see my face. Some pharmacological terms. Okay. First on our list is analgesic. First on our list is analgesic. So when we say analgesic or analgesia, what do we mean? Analgesic simply is a pain reliever. Okay. An analgesic is a pain reliever. For example, paracetamol is used to relieve mild pains. Okay. So that is an analgesia. An antipyretic, or antipyretic. First of all, anti means against, okay, and then pyretic means fever, or pyresia means fever. So an antipyretic is a term used to describe the medications that works against pyresia, against fever. So they reduce fever. An example is an ibuprofen. Okay, so an antipyretic or an antipyretic reduces fever and is called, an example is ibuprofen. Okay, then we have antibiotic or antibiotic, depending on the part of the world you're from. Antibiotic or antibiotic. That also simply means against a bacterial infection. Like I said, anti means against, biotic means bacterial infection. I mean, simply put. So, an antibiotic or an antibiotic is a substance that works to fight infections. An example is an amoxicillin, okay, or amoxiclav, amoxicillin clavulanic acid. Okay, what is an anticoagulant? Anticoagulant, anticoagulant, or anticoagulant. Again, anti means against. Okay, coagulation is clot formation. Anytime you hear coagulation, it stands for clot formation. So, anticoagulant means something that is against clot forming in your body. So, an anticoagulant prevents blood clotting. An example is heparin. An anticoagulant prevents blood clotting, and an example is um, heparin. Okay, a sedative, a sedative, a sedative, or a sedative. Okay, that calms or induces sleep. Any agent that calms you or induces sleep is called a sedative. Now, what is a diuretic? A diuretic is an agent that is used to increase urine output. To increase urine output for so many reasons. Okay, you use diuretic for so many reasons. Can be for BP control, pressure control, to reduce fluid, to reduce fluid accumulation somewhere in your body that we don't want. We use diuretics. Okay, so a diuretic increases urine output. An example is furosemide. All right, let's look at some hospital nursing abbreviations. Some other abbreviations. When you see ADL, it means activities of daily living. ADL stands for activities of daily living, like grooming your hair, combing your hair, brushing your teeth, feeding, bathing. All those things are activities of daily living. We spoke about BID the last time when we said it's twice daily, TID 3 times daily, QID 4 times daily. SOB means shortness of breath, okay? And then start, it means immediately or at once. Sometimes some medications are prescribed and then you will see start. Injection diclofenac 75 milligrams start. It means you are just giving it once and you are giving it immediately. Okay, let me see if I can find a spot that is a bit clearer because the weather is coming dark. The time is about it's almost 5 p.m. here, and so the weather is dark. Let's see if we can find a calming spot, a clearer spot. Yeah, looks like this is better. And it's drizzling, like I said. It's been a while since we have seen some rain, and so as farmers, we will be very happy to see rain today. It's drizzling and it is good. Okay, let's continue with some emergency or critical care terms. Sometimes we use an emergency and also in critical care. Now, if you hear cocks croaking, fowls making noise, you already know by now that we're on the farm, don't you? So I was just trying to find a spot that is a bit clearer because the other side was dark. All right. Yeah. So I think this isn't bad. Is it? I think this isn't bad. Okay. Let's go ahead. So let's look at some emergency or critical care terms. So anytime you hear code blue, it means that we have a cardiac or a respiratory arrest emergency. Okay, and then we need to do what we call cardiopulmonary resuscitation or a CPR. Okay, that is what code blue stands for. All right, code red means there is a fire in the hospital. Sorry, code red means there's a fire. There is a fire on the mountain. That is code red. Sorry, let me just address this. Yeah, code red means there's a fire. Okay. Then shock. What is shock? Shock is a life-threatening drop in blood flow to your organs. Okay. Anytime we say shock, it means that there is reduced blood supply to the organs of your body, and it means it needs immediate intervention. If not, your organs will shut down. Okay, we have different types of shock. You can see it in bleeding, you can see it in severe sepsis. Okay, and you can see it in some spinal injury. There are so many types. But bottom line is that there is reduced blood supply and your organs are being threatened. Okay. So anaphylaxis, what does anaphylaxis mean? Hello, if you're just joining us, you're welcome. And this is smart nursing. I just have to change positions because where we were was dark. And I think my fowls are making so much noise and you can hardly hear me. So let me try and change my position again because I think they wouldn't let us be. But I've been talking about medical terminologies today, and we have spoken about some terms we use, some medical abbreviations we use in the hospital. Okay, for nursing students, this will be like a refresher to you. And then for our patients and relatives, you will understand what we mean when we say certain things, okay? Because we are in this together. And so we just spoke about anaphylaxis, which means or which stands for severe, reaction. Okay, that is life threatening. Or, some people have allergies, and when they mistakenly eat the things they are allergic to, or for some way or the other, that allergy finds their way into their body, it generates some reactions, okay, and that can lead to death. That is what we call anaphylaxis reaction. So let's continue by looking at CPR. I said earlier it means cardiopulmonary resuscitation. It's a whole procedure we do in cardiac or respiratory arrest emergencies. Okay. So what does defibrillation mean? What is defibrillation? Delivering an electric shock to restore heart rhythm. I know you know where. So at this point, I just want to find another spot. Okay. Let me see if I can get another spot that is a bit clear. Let's come this way. Because sorry. So sorry guys. Sorry guys. Yeah. So I want to find a spot that is a bit clear so we can have a conversation because like I said, the weather is getting dark and we all right. So defibrillation means delivering an electric shock to restore heart rhythm. If someone has a cardiac arrest, the heart goes into dysrhythmias. And if it's a type that we can restore using an electric shock called defibrillation, then we do just that. Okay, on we go. On we go. And we are talking about some descriptive symptom terms. Okay, let's do this. Describing. So I hope you're liking a little tour of the farm. A little tour of the farm. I hope you're liking that. I'm just trying to go away from the fowls so they wouldn't have to disturb much. All right. Yeah, I have to go back a little. Just a little. Okay. Let's see. This isn't bad, is it? Not at all. So, atrophy. What does atrophy mean? Anytime we say atrophy, what does it mean? It means wasting away of a body part or a tissue. Okay, the place is wasting away. Most at times because it is not being used. All right, if you see somebody who is not using a part of the body for a while, the place wastes and becomes smaller. Okay, and that is what we call atrophy. Atrophy, atrophy. So it's wasting away, or you know, of a wasting away of a body part or a tissue. So if atrophy means wasting away, what do hypertrophy means? Remember we said that hypertrophy, anytime you hear hyper, it means more than or higher than. Okay, so a hypertrophy will be an enlargement of an organ or an enlargement of a tissue or an enlargement of a body part. Okay, so atrophy is wasting away or reducing in size. Then hypertrophy means enlargement of the site. Okay. Yo, hello. So what is pallor? What is pallor? So I was just saying hi to a neighbor there who has this from the farm. Okay, saying hi. Pallor means unnatural paleness. Okay, so the skin is supposed to be pink, supposed to be very, moist. It has its own integrity. It shouldn't be pale. All right. So if you are or the color of the skin is the scarlet and it's not bluish. If it's bluish, it's side nosed. If it's not side nosed, then it can be pale and it's called pallor. Okay. Then we have pruritus. 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 It means itching. Okay. So anytime we say pruritus, it means itching, itching of any part of your body. Syncope means fainting. Syncope means fainting. Okay, so where there is syncope, it means fainting. Somebody has fainted. We said syncope. Then vertigo means spinning sensation. Vertigo, Vertigo. It means spinning sensation. So you can see the person will describe it as I feel the room is turning or my face is turning, like vomiting. That is what we call vertigo. Okay, so once again, we have been talking some medical terms today. We've been describing some medical terminologies we use, what they mean, what they stand for, and we'll just be changing locations because we want some natural light. Okay, and it's 5 p.m. It's 5 p.m. here in Ghana, and we have been talking about some medical terminologies today. This is Smart Nursing. We talk about nursing. The channel mainly is for nursing tutorials, but then we also talk about anything else that is related to nursing and also some personal nurse life experiences that we share with you, especially when we come on the farm because we farm also. And the last time we all found out that there was so much similarities between farming and nursing. And I am so grateful today for all those who joined our live stream. Grateful to Jerry, Soha, Stephanie, Tofik, Cheese, and all others who joined us today for this live streaming. Watch out for our video on acute coronary syndrome, which we will be dropping very, very soon. Check out other videos on our channel. We'll be doing some ECG series so far. We just spoke about atherosclerosis. We have discussed some myths about nursing. We spoke about virtual reality being used, in nursing training, and it is helping a great deal. We have done some, simulations about mass casualty. We did a training, we did a simulation, and a whole lot. So check out our videos, okay? And we will be very, very glad to know your feedback. Let us know uh, what you want to know. Basically, let us know what you want to do, like what we should give you next. We will be glad if you give us ideas of the topics that you want us um to talk about, because I am very, very passionate about nursing tutoring, very passionate about nursing, you know, training, very passionate about how we bridge the gap between training and practice. Okay, because I have been a nurse for over a decade now. I started off as a diploma nurse, then I did my first degree, and then I specialized in emergency. And I've been working since 2010 as a registered nurse in Ghana. Okay, I have sat for several exams, both locally and internationally, and then I could see some, need, or I realized the need of bringing nursing to our doorstep, because you realize that sometimes if you want to follow the classroom teaching and just follow classroom teaching, it becomes too abstract. that it becomes very difficult to appreciate and understand. All right, so videos like this, nursing videos, tutorials like this helped me a great deal when I was preparing for, you know, exams, like I said, both internationally and then local exams, and also for my residency program. And so I'll be very, very glad if I could also touch someone, you know, doing these videos. And so this is where we'll draw the curtains for today, my people. Thank you so much for joining. Thank you so much for liking and subscribing to Smart Nursing. Please share this video with your friends, invite them to subscribe. Let us grow together. Let us nurse together. Let us share nursing together. Thank you so much for joining. If you just joined us, can you give me a hi? Can you give me a like? Let me know where you're coming, watching us from. Sorry. And my name is Ness Evie. This has been Smartness in People. It feels so good to be here. And I don't want to go, but we have to. Okay. But before we go, though, is there any question? Does anybody have any question that you want to know? Is there anything that has been bothering you about nursing? Is it because specifically to abbreviations today? Because today we're talking about abbreviations. Have you ever come across any nursing abbreviation or any nursing terminology that baffled your mind? If yes, you can let us know, and let's see how best we can help. Okay? Anything aside nursing, though, I'm also a Christian. Okay, I'm also a Christian, and then I fellowship with my family. I'm a married woman. I'm married with three beautiful children, three for now. Married with three beautiful children, a girl and two boys. Then I'm also a Christian and I fellowship at the Global Evangelical Presbyterian Church. Okay, today we had a beautiful wedding at church. And then our pastor spoke about the need for us to share the word of God. Okay. I mean, Jesus is the way, the truth, and the life, as we Christians believe. And we believe that it is only Him and only through Him that we can make heaven. Okay. And so we need to share this good news with our friends. We need to share it with our colleagues. We need to share it with anybody that we come across. Okay. Christ in you is the hope of glory. Having Jesus Christ gives you a peace that surpasses all understanding, a peace that you don't know you had, a peace that you can never describe. Okay. The Bible makes us understand that in the beginning was the Word was God, and the Word was with God. The Word of God has been there from the beginning. Okay, it has been with God, it is God itself. The Word is life. So when you have the Word, what will you lack? Absolutely nothing. Okay, and so I would just want to share that with you also. Do not forget that there's a God up there, a heavenly Father that is watching us, that is taking good care of us, that knows us more than we know ourselves. All right? He is the omnipotent, omnipresent, omniscient God. There is nothing He cannot do. Absolutely nothing He cannot do. And so if you're in any position that you feel like you have nobody, that you feel there is nowhere to lean to, Know that there is a God who is there and is willing to help when you call on Him. Okay. So thank you so much. This has been Smart Nursing. This has been another live video from the farm. We have spoken about some medical terminologies here today. We have described some diagnostic, some procedural, some abbreviations, some nursing terms, some anatomical, and so many others. Thank you for coming. Like, share, subscribe. Watch out for our other videos. We will see you again on a live, most likely on Sunday, God willing. And then this is where we say bye bye. See you, okay, in another video. Love you all. Mwah.